Good evening, viewers, and welcome to the discussion this evening, which is focused on e-learning, and in particular, e-learning in a medical and health context. But before we get into the show, I'd like to just remind all viewers that the show is available on the internet on itv.networks.tv, and one can go to the website and simply click on the live streaming button. The show is also being viewed in 20 countries across Africa, in the Middle East via Your Live, Zenga TV in India, reaching approximately 30 million viewers, and also on Ghana TV. This evening we will be focusing on e-learning. Learning and teaching are being challenged today. There are dramatic shifts in the focus on how learning and teaching is taking place, and I have with me a panel of speakers who will be joining me in this discussion for the next hour, and I'd like to introduce them. Firstly, I'd like to introduce Dr. Nkomo. Dr. Nkomo, welcome to the show. Dr. Nkomo represents the e-learning foundation. I have with me as well Rahul, Raina, who is the corporate vice president of Ebix and head of international sales.
Good evening, Mike.
Good evening, Rahul. And I have with me Gautam Sharma, who is the manager of business development, of international business development for Ebix. Welcome to the show.
Mike.
Gentlemen, learning and teaching are being challenged. And before we get into the specifics and the heart of this discussion, which is focused on the particular offerings associated with e-learning in a medical context, I'd like to start the conversation with a general discussion on developments in e-learning. And Rahul, possibly I can address this to you initially. Perhaps you can give me some background and some of your thoughts on what are causing the shifts and what's changing in the market.
That's a very interesting question, Mike. In fact, I remember my first exposure to e-learning was in 1999, and I was totally intrigued by it. The possibilities that it opened up for the learners in the world. And I think what has the adoption rate, what I expected it to be when it started in 1999, versus, let me take a step back here and try and compare it with internet. Remember when you and I were growing up in our, when we were in school, college, internet was not available. And if we were to work on a research-based project, the only options we had were to go to the library, go through a series of books, find the right subject, and then basically spend hours and hours of time researching and then finding the relevant material that we were looking for. But nowadays, it's all instant. If someone is looking for some information, they can very readily, that information is available and it's instantly available to the user. So the adoption of internet has been extremely good. When internet came in, everyone thought that it's going to take some time, but just because of the benefits of internet, you saw that the adoption was very high. In case of e-learning, my expectation, personally, I believe that the amount of opportunities it opened up for the learners, the adoption had to be very high. But I believe even today, 15 years, 20 years, 16 years later, after my first exposure to e-learning, I think it's still at the beginning of the adoption. I think there's a long way to go, just again, because of the opportunities it presents to the
I think you raise a very interesting point, and maybe Dr. Nkomo, you might want to chip in on this. But adoption is the issue. And we talk about changing delivery of education. We grew up in an era when education was structured and facilitated by a subject matter expert. Mm-hmm. And today we're expecting youngsters to be self-directed in their learning. Mm-hmm. Do you have any thoughts on the adoption of e-learning and how that change is being manifest?
Well, fortunately, I think that the policymakers have caught up with the speed of change. And, well, for us, it's an interesting thing because what you are able is to integrate time and space into the learning process. In other words, traveling time is reduced, and you then have instant, in your own space, as you say, self-directed, in your own space, comfort space, you are able then to access, so that we have seen how that, in fact, also then nullifies the wide gap between, urban, rural, so that you will find that, in fact, a student, a learner, who resides somewhere in the far outlying hinterland, you may find that they're actually at a par
I think
with someone sitting right in the, in the city lights.
I think that's a very valid point. So we virtualize distance, and we enable anyone who technically can get access, and this becomes a policy issue for governments and so on. Tonight's focus is not on where are we with broadband rollouts, etc. We know that there are changes. We know that there's investment and policies, and we will see over time a reduction in costs and so on. So we won't spend too much time focusing on the infrastructural needs. I think the psychology of learning and the approach to learning is what's important. And another challenge that we find is concentration span and time pressures. And the idea of sitting and attending full-time study, or the idea of having to travel to a face-to-face class and give up a few days, today we're seeing a shift to fitting in learning.
Exactly.
We're also seeing a shift away from only youth-focused learning to continuous learning. Any comments on that before we get into a discussion on A.D.A.M specifically?
Mike, in my opinion, I've always believed that self-learning is obviously something that's extremely useful. But again, coming back to e-learning, I don't believe that e-learning is going to replace classroom training. It is going to be in conjunction with classroom training that e-learning is going to be extremely helpful to a learner, to a user. That's my opinion on how e-learning and classroom training are going to go together. But the benefits, obviously, and I don't know if you want me to go into the benefits of e-learning versus classroom training, particularly from a user perspective, because now here it ensures standardized delivery of the same content across hundreds of thousands of users, which may not be the case with the classroom training, because each trainer would or teacher would have their own interpretation and their own way of delivery of a total of the study material, and I think that's what
I think there are a number of benefits, and a learner being able to do it at their own pace in a time convenient, etc. And we're seeing, while there have been experiments with massive open online content, or MOOCs as they're referred to, we're seeing a tug of war between traditionalists and innovative education. And what's in the middle is, I think, the sweet spot at this point, which is blended, and it's a combination. And it allows individuals to progress in their own interest areas. So I think let's focus now and start moving towards the core of our discussion this evening. And we're going to be talking around A.D.A.M education and the offerings that you have in a portfolio. So perhaps you can talk to me about the market that you are trying to reach with this portfolio of offerings that A.D.A.M education brings to the market.
See, A.D.A.M education, A.D.A.M as a brand, we cater to three main segments. One is A.D.A.M education. One is material available, content available for the masses, what we call citizen education for the healthcare. And the third is the material specific for training of specific segments. So in case of A.D.A.M education, the first product that we offer is AIO, which is A.D.A.M Interactive Anatomy, which is targeted at K-12 market, kindergarten to 12th grade market. And the second product that we have, which is A.D.A.M Interactive Anatomy, is targeted more towards the 10th plus grade students to first year medical students for anatomy study. And besides this, we develop a lot of A.D.A.M on-demand products which cater to specific segments, whether it's nurses training or nursing training, or training around pharmaceutical reps and so on and so forth.
Okay, so I think that's excellent, because what you're saying is you've got different offerings for different segments of the market.
Right.
But what I'm also hearing, Rahul, is that you're going beyond the mere provision of information. Because if you say that there's specific training focus, then I'm assuming that within your offerings there's some form of assessment, there's some form of working tools that an educator might use to control the release of information, annotate and various other things. And there's also resources that you can make available to specialists and customized training for specialists. So it's quite a broad set of offerings.
It is. It's a real broad set of offerings that we can actually go into. Gautam can actually walk us through some of that material.
Okay, so I think what we can start to do is to look at that. So I think let's draw the focus here and say we're talking to a large viewing audience. Okay. This viewing audience is individuals. Some might be at school, some might be students, some might be in medical support roles, some might be medical professionals. Mm-hmm. Let's try and draw a context and say, well, what can these people do with A.D.A.M? Where can we go with offerings from A.D.A.M? So perhaps if I can switch to you now, Gautam, and say,
sure,
give us an introduction and of the scope, the features and the application that you bring with the portfolio of products.
That's fantastic. So if I have to specifically drill down into the medical part of it, the medical e-learnings. So now you have access to some of the best resources of the world, which were very, very difficult to access at a certain point of time. Maybe around 10 years back, I mean, any doctor is passing out of that. They had to have those real human cadavers. They had to have those, animals that they need to dissect, and all those things were happening, and they could not have that access and that learning, at that point of time. But now with the advent of technology and all those things and the products that we have tried to bring into the market, we have tried to ensure that a great, a subject with a huge scope such as anatomy becomes so easy and is with a student 24/7, so that the moment he wants to understand now that how would, let's say for example, the 233rd layer of a human body look like if I dissected it layer by layer, what would I be able to see, which are the parts in there. So we've got all these different products, and if I had to, tell you the range of the products, and as Rahul has already spoken, so we have got products for the schools, wherein kids like 7th graders, 8th graders, 9th graders, they can learn about the human body, they can understand about the human systems, the body systems. We try to do some part to the society by explaining them that why should you not be smoking? Why should you be, doing physical activity? How are you going to be benefited? So basically what we are trying to do is in these, school kids, give them a sense of responsibility towards their own body, which I think is a huge concept, which is very important in today's world, as we're all moving and we want healthy citizens.
Now, what I'd like to do is I'd like to actually just draw us to a break at the moment, but while we go to the break, could you prepare to give us some form of demonstration of what you're saying?
Sure, I will.
All right, so viewers, we're going to be going away for 2-3 minutes. Don't go away. We'll be back with you in just a moment. Thank you. Welcome back, viewers. Gautam, take us through a demonstration and some coverage of how this works in practice.
Sure. So I'd like to do that now. So what we're talking here is the A.D.A.M Interactive Anatomy. Now, it is one of the first interactive anatomy tools that was launched into the global market. We've had a huge acceptance of this product, and right now, students across the world are using this. So I would like to show you how it works. So you can see, a human body here on my screen, and I can dissect it up to 330 layers. So what I'm going to do here now is I'm going to take it, for example, to the 214th layer to explain to our viewers that, how does it work and what can you see if you dissected an actual human body to the 214th layer. So you can see on my screen that this is how, the brain would look, this is how, the neck would look, and you can see the lungs, you can see the liver, you can see the arteries here. So I can just click on it, and it is giving me it is the arc of aorta, for example, and I've got the inferior vena cava here, and similarly, this is the superior upper lobe of the left lung. What I can also do with it, to make it more interactive as a student, now I need to understand how it goes. I can go to, let's say, the options here. I can, change the appearance. I can, add, we've got around 9 languages here. And similarly, if I went to tools, I can actually use the different annotation toolbars that we've got. For example, we were, to understand how the bypass is going to work, so you can take the paintbrush here and I can choose the brush size. So what we are doing is we are giving, that freedom to a student to go through it and at the same time use these tools, learn the different body structures and body systems. So I'm just, doing a little bit here on my screen, and you can see, so this is how it works. So this is one of the most accepted tools for anatomy education here. So this is, mainly being used by the schools, by the pre-med students, and now has been a part of the bedside consultation for the medical professionals. So they are, going to the patients. They are, they've taken up this responsibility, and slowly it is getting now worldwide that doctors are spending a lot of time with the patients in explaining them the procedures, in explaining them that what exactly do they have to pass through, and making their whole knowledge base more wide. So that is what we're looking at with this kind of a tool. So this is the A.D.A.M interactive anatomy that you just saw on my screen. Similarly, I will take you to one of the other products that we've got. Now this product has found a great acceptability in the paramedical and nursing fraternity of the world, with the likes of Australian Nursing and Midwifery Federation and similar organizations using this. So now we've got around 150 courses here. Now these courses are structured like there are different therapeutic areas. For example, the cardiovascular system, the respiratory system, or the reproductive system. Now what you want to know is that how it works, the introduction to that particular therapeutic area, the introduction to the cardiovascular system, for example, or the understanding the anatomy and physiology of the cardiovascular system. Then you drill down into the disease management. For example, understanding stroke, understanding myocardial infarction, or understanding lipids. So that as a paramedic now, or as a student of nursing, or maybe as someone who is associated with a pharmaceutical industry or has to explain, and all these students worldwide, you are now able to understand that concept, starting from the anatomy, going into the disease management, further drilling down into the medical procedures and diagnostic tests.
Now, if I could just ask a question there.
Sure, please.
This information is available in a normal text form, in books, etc. What makes A.D.A.M different here? How interactive is that, and what value does it bring having A.D.A.M in rich media versus traditional education tool sets?
So the main thing that we bring to the table, and Rahul would like to add here as well, is authenticity. So we are working with the top doctors of the world. Doctors from the Harvard Medical School, doctors from the University of Washington, doctors from the University of Chicago, or the likes of the top schools from Johns Hopkins, from Cleveland Clinic, working with us in developing this content, in updating and upgrading this content. So we want to ensure that, whatever we are developing is the most up-to-date content, is the most interactive content, and is so easy to understand that we just don't want to leave it to imagination anymore. We want you to look at the whole procedure.
To add to what Gautam is saying, I think that's what the difference is. Again, coming back to what I was saying earlier, Mike, when we were growing up, and if someone were to explain to me how heart attack happens, and I were to visualize it, it was extremely difficult. But in this day and age, with the animations that we have, a user can actually look at exactly how the whole heart attack happens. Build-up of the plaque and how it stops the blood to flow in certain parts of the heart, which eventually would lead to myocardial infarction because oxygen supply to that area is not possible. And I think I've learned this. Very frankly, after I've seen these animations, this part of how it really happened, I may have read this while I was a student, but never was able to comprehend it. Yeah.
Seeing it.
But seeing it
Can you
makes
show
a
that
difference.
to us?
Sure.
Yeah,
So,
but of course, I think there's another important element in this thing. Because, see, I don't like to use the word patient, but the patient must give consent. Must this operation be done? but
Yeah.
they don't have the focused idea what you're talking about.
No,
What
no,
part of their body you want to access. And yet with this, now you can't take people who have gone for hospital treatment to the mortuary to see a cadaver there under anatomical dissection. But with this method, then they can see right there exactly what it is that they're going to be and what it is they're giving consent for.
All right, so let's have a look at a demonstration of this animation.
Fantastic.
Because this to me sounds like it's replacing when I visit a doctor and he's got a picture of a heart on the side of his table, a little model that he can pull off 3 chunks,
Right.
you know, or he's got this classic skeleton in the corner of his room. So you can do this now
On an iPad or on the computer that he's got to explain it to you much better. So what I have on my screen is one of the courses, which is the principles of cardiac catheterization. Now here I have, made the storyline. I have made it interactive. So now there is one Dr. Nobash who is a cardiologist. Now he's going to be explaining you and walking you through the whole of cardiac catheterization procedure room. So as a nurse, you know this is what is going to happen. As a patient, you understand this is what is going to happen. As a doctor, he's telling you that this is what is going to happen. So what is happening is this 360-degree awareness from all the corners and all the different, parties involved in this whole procedure. Okay. So let's have a look at that.
To perform a procedure called percutaneous femoral technique to access Brian's coronary arteries. This technique is used in most cardiac catheterization procedures. First, I'm going to inject some local anesthetic to numb the area of the groin where I'll be making a small incision. I will then insert a small tube called a sheath into your femoral artery, the blood vessel that supplies blood to the thigh. I will place catheters through the sheath all the way to the aorta and eventually reach the left side of the heart. That is why the procedure is called left heart catheterization. If I had to access the right side of Brian's heart, I would instead insert a catheter in the femoral vein. This is the blood vessel that drains blood from the thigh. Today, we want to examine Brian's coronary arteries, so we will perform a left heart catheterization. Are you ready? You will do great, Brian. Using this...
Were you able to see that how the doctor explained the whole procedure? We have, a character here by the name of Brian on whom the procedure is going to be performed, and the doctor is explaining you that from here the insertion is going to be made, here is how it is going to reach to the heart, and this is how it is going to work. Now just understand how easy it made it for all the parties, the paramedics, the patient to understand this thing and make it much more live.
So what you're suggesting is there's substantial benefit to all parties. Yeah. Number one, the doctor has a resource that he can use to explain to a layman. And what I'm hearing in the language here, and it's quite interesting, is the register of the language is set at a reasonable level.
True.
Is there a strategy in the product in terms of what level of complexity of language you use? Because medical scares a lot of people.
There is. In fact, the level of language that we use is based on the target audience. One of the products that Gautam walked us through, the first one, that was A.D.A.M Inside Out, if we go through that module, it's basically built for someone between the age 6 to 12 years of age. So the language is appropriate for those kids. For other products, the language text used is based on the maturity of the audience.
It's very important because if we take an African context, Dr. Nkomo, English is not necessarily a mother tongue for a large percentage of the population. So the level of literacy or the level of language is quite an important factor in terms of being able to reach the person. And perhaps even in our scenario, we might need community workers to even assist with translation. So complexity and the level of complexity, I think, is a critical element.
Absolutely, but of course I would like to say that in fact it's universal. Mm-hmm. For instance, if you got somebody as doing this in Japan, who is an American or an English person, then of course you must try and find a medium of communication which will make sense to the recipient of the information or participant in the conversation. So then, with this kind of audiovisual, if I may put it that way, you are then able to democratize access to information so that it is not hidden within stilted technological lingo, but is able to be accessed by every person who is participant, because that is why I didn't want to use the word patient.
Patient, yes.
Yeah, because it's as if, you just got somebody who's a stone and something procedure is being done on that stone.
Okay,
Whereas
so
what you find, in fact, when you then have informed consent, that is why then this audiovisual is a very important tool, universally.
All right, Dr. Nkomo, thanks for that. I think what we've been focusing on quite a lot now is the communication between doctor, patient, and support staff, etc. I'm going to take us away for a break, and when we come back, I'd like us to focus on some of those specific audiences and what are the benefits, and let's separate the citizen and the medical assistants and the doctors and talk about them individually for a few minutes. Let's take a break. Viewers, we'll be back in 2 or 3 minutes. Welcome back, viewers. We were talking about a general environment where we had doctors, support staff, patients, etc. And I think that's one context in terms of the application of medical information and medical e-learning. But we have an awful number of citizens that could potentially benefit from their own learning, either in the form of them preventing a medical incident from getting worse or allaying their fears, or even following up from a doctor visit perhaps, where they could find more information that is trusted information. So perhaps we could talk about the strategies and, let's say, for example, national policies associated with where do we want to take our citizens in terms of ownership of their health, and how would this then benefit? So Dr. Nkomo, can I start with you? What do you believe is or should be happening in terms of that ownership of one's health?
Yeah, well, people, first of all, should be empowered with knowledge. Now, you see, most of the innovations which are introduced by national health departments all over the world have got one hurdle to jump, that is to get public awareness and ownership of the new policy that is being introduced. And so that's why then it's very, very important to have a lingua franca which enables easy access for every John and Elizabeth of this world.
So as we progress, there should be a national imperative where, as a national department perhaps, one aggressively promotes health literacy.
Absolutely,
and
absolutely.
then this is in the hands of the average citizen. So with the A.D.A.M offerings, I'm assuming, therefore, that any citizen could subscribe to access these tools as an individual?
No. Yes, as an individual for all learning products, yes. But we have a particular product that, large countries like United States, for example, they have a National Library of Health which promotes citizen education for health. The license we have a product called A.D.A.M Encyclopedia, which is one of the largest digital medical encyclopedia in the world today. It basically empowers a citizen with the medical information, that authentic medical education, medical information that is readily available over the internet, and this is provided by the National Library of Health. There are other countries where the health departments, the Ministry of Health, are, in discussions with us in using this resource for the benefit of their citizens, to empower them.
Of the broader population.
For the broader population.
But let's get it down to street level, all right? So I'm a middle-aged man with a diet that's probably not as good as it should be, and perhaps carrying a bit more weight than I should be, and I hear these rumors of cholesterol and challenges, all right? If I'm concerned and I had access to, for example, your A.D.A.M tools and services, can you give me a practical example of how I could say, maybe I've got a chest pain or maybe I'm concerned. What could I what could I actually benefit from in terms of access to these services?
Sure. So adding on to what Rahul has told you about the digital medical encyclopedia. So we have one of the world's largest medical encyclopedias, he has told, with the likes of the National Library of Medicine, which is the world's largest online medical library, through its directory services like PubMed Health, Medline Plus. Now these are the top portals of the world where you want to search information about you, are promoting it. So what we have in the encyclopedia, if I drill down into it little statistically, around 6,800 articles and growing, right, which cover around 4,000 illustrations, around 400 HD videos, right, around 85,000 internal hyperlinks. For example, if I was going through an article on heart attack as a citizen, as a normal man, to just see what is happening around, and then I see chest pain. Now I have the option to then just jump onto the chest pain article, learn more about chest pain. Similarly, from there, I have an option to maybe, while we're going through the chest pain article, somewhere asthma is mentioned. So now I have that option to get into the asthma. So what is happening is that instant knowledge, what I want is there, and the knowledge now is from the most authenticated content, written by the top doctors, accredited by the top bodies, who are there to accredit such content, and we give out the names of the doctors, we give out the dates. So we are taking responsibility for the content. And that is the reason, why even like big search engines, they want to work with us, because when it comes to health, then they just do not want to take chances. They want to put something which is authentic, which brings in some responsibility to them. So what I'll just show you is a small little snippet of if you as a common man wanted to understand how myocardial infarction or heart attack, in a more layman's term, occurs. So let's have a look at it.
Myocardial infarction, commonly known as a heart attack, is essentially synonymous with the acute coronary syndrome spectrum classification, or STEMI. It occurs when a large part of the heart muscle is deprived of oxygen after a sudden and complete or nearly complete blockage of a coronary artery. If the flow of blood is not restored quickly, the affected heart muscle becomes damaged from lack of oxygen and begins to die. The patient will most likely complain of chest pain, nausea, sweating, and difficulty breathing. However, as many as 20% of myocardial infarctions may go unrecognized because they are silent and do not cause any pain. Myocardial infarction is a medical emergency.
So Mike, I'm sorry. So here I want to pose you a question. So you saw this video. Now as a common man, or maybe someone who doesn't come from the medical background, just tell me your experience of how you found it.
A couple of observations there. First of all, is that the content does draw you in, because it's not a static image. Perfect. All right, and the language is understandable to the layman, and I think that's important. All right, so having it in a graphical way, having it animated, and having it in a language which is easily understood, I think certainly is particularly useful and appropriate. Yes,
absolutely, Rahul, and the context, you see, because there have been so many public education programs. I know it for a fact, even in Canada and the United States, where they're dealing with obesity even in children. Now, you see, if you come in with a package which says don't, like an old Mother Grandy, then you switch off your audience.
Absolutely.
And that has not worked. But I think that this graphic, imagery, then is able, because it's neutral of an agenda, but all it does is to provide you with information so that you as a person can make a judgment, even a child can make a judgment which is neutral and which does not seem as an imposition from some very difficult Mother Grandy.
I'll give a practical example in the South African context. HIV education at schools. I have 3 daughters. And eventually they came to me and said, Dad, could you write a letter that says I don't have to attend these sessions? We are sick to death of hearing it. All right, and it's being forced down our throats. But it was a static, boring delivery. I believe that in their own rooms or at home on a shared family computer, if they went through things at their own time and looked at the parts that they wanted to investigate, it might have more impact. So I think, yes, I think that's an appropriate register from a delivery perspective. But let's move on to the concept now. So that's Joseph, the citizen, all right? That's what he can get as a benefit. But one of the things that you mentioned when we were talking about education is, teaching and learning is quite different. Teaching is a progressive delivery. Now, these are wonderful animations, but they show everything. Is there an ability, for example, for teachers to control how much is displayed and to allow for a progressive learning, either through bringing on labels or adding annotations or having discussions, or maybe even get their learners to present that? Is there any comment that you might have on that?
In one of our products, we have what we call curriculum builder, which basically is exactly what you're talking about. This allows a teacher to pick snippets of the content that they are actually looking to teach in a particular classroom, in a particular session, based on the learning objects for that particular day, and add images, add structures around it. So yes, to answer your question, a teacher can control what they want to show and not give away all the information in one go. So if you want to kind of control based on the learning objects, and you can do that.
See, and one of the important things here is that what we're trying to create is an environment wherein we are able to involve everyone. We do not just want maybe the teacher to give a username and password to the student and just say that whenever you have time. Of course, that is the advantage, but not participate. What we're wanting is that students and teachers to be as excited about it as I'm coming to the general part of it, to the general e-learning, that how are we going to make it successful? We cannot just make it successful with one part of the society adopting it. So it has to be a multifold adoption. It has to be a 360 adoption, wherein the teachers find it as interesting, as intriguing, and they're happy to position these things. They're happy to show these things because one, it is giving them one standard delivery method or like mechanism as Rahul has told, and second, now the students have something which is coming from the top bodies, top associations, top organizations, something that has been adopted in the past, and giving both the sections of the society much more leverage to now involve in a learning environment.
Okay, excellent. All right, so we're going to stop on that point. We're going to go away for a commercial break. Viewers, we'll be back with you in 2 or 3 minutes. Okay, good. Welcome back, viewers. Gautam, I want to thank you for that part of the discussion. I think we've addressed a multitude of different audiences. You've talked about the passion of educators and their involvement. And we talked today about modern learning, which is collaborative learning, project-based learning, active learning. And I see this as a good platform for allowing participation and project work. And we know that when learners verbalize something, they learn much more than when they just take it in passively. So I see substantial benefits in terms of a number of these areas. What I'd like to move on to now is we're living in an age where there's an awful amount of what we call information out there. You just have to do a Google search and you find millions of articles on any one subject that you choose. And the onus on the reader, the viewer, the searcher, is to become more discerning. So where many of us think that there's too much information, yes, there's an abundance, but one masters the ability to search effectively and to discern. Now, one might say that, this is a viable platform, but isn't there as good information perhaps on Wikipedia? Isn't there as much information available at no charge to users, viewers, on other platforms, search engines, etc.? How would you respond to that, Rahul?
I think, Mike, you're absolutely correct. There's so much information available on the net today, and it's very difficult for a user, internet user, to be able to differentiate between an authentic content versus what anyone can actually put up on the internet. Our content is evidence-based. It is authenticated. Each of the articles that we write is reviewed by the doctors, and each article has references: who reviewed it, when was it reviewed, and each of the articles also is, based on our editorial policy, is looked at every 6 months. So to ensure that it is current, because things keep changing in the medical world.
And new crises emerge.
Correct. And so I think it's extremely important for a user, and that coming back to one more point, and that's one of the reasons that Google, for example, is a client of ours. And for most part, Google charges companies to show up in the search result, whereas in our case, when they show us as the number one, provider of this information, they pay us. So it's totally different model that we have, and the reason for that is because I think it's a social responsibility that Google is working on. They want to provide the content which links to the content that are authentic,
Okay, I think we've hammered that point about the authenticity, and I think it's a very important differentiator. I think the next step is one of the major challenges with e-learning is the diversity of technology. All right, we're seeing massive innovation in terms of new platforms coming to market and price competition, driving in Android tablets at $100 or $50, and expensive platforms. Privileged people have got different systems. When we talk about the masses here, how do you reach an audience on this diverse array of platforms and standards?
An extremely important question, and everyone in the e-learning world, the players in the e-learning world were struggling with this, even today are struggling with this, because a majority of these programs that you've seen, e-learning, basically uses Flash. A lot of these programs use Flash, and the iPads of the world, which is a dominant, a tablet today, controlling majority of the market share for the tablet section, it does not support Flash.
Yes.
So what do? All this content that has been developed by likes of A.D.A.M cannot be used by the users because everyone is using to Android devices, to iPads. Now, for us as a company, what it means is to port these for BlackBerry, for Android-based systems, or for iOS-based systems. So we've come up with the strategy where we have developed our content, now are developing our content in a responsive web design mode, which is basically HTML5. So that makes our content device independent. So our content can be viewed on an iPad, on an Android-based tablet, on any handheld device.
Any browser, basically, that supports
Correct.
HTML5.
Correct.
So not only are you keeping your content current, but you're keeping current with the modern standards.
Correct. We tried to.
It's a critical factor, and also with the recycling of technologies, that one does stay current with that, and you don't lock into a particular user segment. If you're aiming at the man in the street, you have to have that diverse support.
Correct. And to add to what you're saying, Mike, to coming back to what I'd said initially was the adoption has not really been so great in the e-learning world. I think one of the other reasons is the content is not available. Again, there's a lot of content available on the internet,
yes.
but I'm talking about the content which is evidence-based and
peer-reviewed.
Correct, peer-reviewed. So that the content for all different subjects is not available, and as we as the adoption increases, we'll see a lot more content provided, developed content for all different areas, including health, and that's when the adoption I see that would start increasing quite a bit.
Right, so before I move to the final parts of this discussion, I'd like to just say that what I'm hearing is that there are different target audience with specific offerings for them. The currency and the legitimacy of the content we've discussed, I think, in enough detail, and you're driving to embrace whatever platform users happen to choose and use those standards that are supported across the board. But where to from here? All right, if we have a look at where you're positioned today, putting on your future cap, putting on where you think the market's going, what kind of thing do you think you'll be doing in the next 3 to 5 years? Where are you aiming with this portfolio?
There's one other section that we've not really even touched on is the one of our product ranges for CME info, which is for continuing medical education for the doctors. And those are the programs that we work in conjunction with likes of the Cleveland clinics of the world, the Johns Hopkins, where we work with them in recording the sessions, and which are accredited by the ACPE in the United States. So that's one part. We see that part, the continuing medical education for doctors, for nurses, and again, I'm totally focusing on keeping blinders on for the health part here. I think that's one area that I think we'll see a lot more growth in. One other area that I think United States has made a lot of progress in is the EMR, electronic medical records. What it also does is, and when you go to a particular doctor, you also have a patient-facing website, and it could be a local general practitioner who's a doctor. You go there once you're back from the doctor, he would send you a link, or you already have a login, and you have all the information available about your health condition, whether your reports, your whatever conditions that you have to go through, but also, in addition to that, if you are suffering from a condition, the links to certain articles,
to that content,
which would help a citizen become more health conscious and follow the do's and don'ts for the particular disease condition that they're.
All right, I've got 2 or 3 minutes in which to wrap this up, and I want to go to Dr. Nkomo now. All right, what do you see as the next step from a Louis Pasteur perspective in terms of national agendas? What would you say are the big priorities that we need to look at in the near future?
Yeah, well, of course, I mean, we've locked into the area of continuing training precisely because curricular syllabuses, they change precisely because of the changing nature of our environment. Some of the things which were not imaginable, say 20 years ago, are eminently doable now. But then, of course, then you've got a paucity of the people who have had access to that knowledge. And therefore, you spoke about this classroom that is being replaced, but you see, you actually need that classroom to be brought to the hinterland of the country. We are then having a situation where, well, there is a scarcity of certain people with certain knowledge, and yet, in fact, it can be sent to the length and breadth of the country.
So, Dr. Nkomo, perhaps we are reaching a critical point here where we have no choice but to start embracing technology.
Absolutely.
To underpin the delivery of education and training in the medical field.
Exactly.
Because the costs of moving people about, etc., are prohibitive, the logistics and so on. So let's move. I'm going to move now to a final wrap-up. And I'd like to say, well, where to from here in terms of the citizen, in terms of learners, in terms of students at university, in terms of medical support personnel? How can they engage with A.D.A.M today? What could they do to take a look at your services? What could they do to engage and take the benefit from your systems?
We have different websites where we direct the users to for different segments. I'll let Gautam.
Right, we've got about 30 seconds. So
talking about the websites,
yes,
we've got one which is www.adam.com, which gives you a whole perspective of all the things that we are doing, specifically for the nursing courses and the paramedics and the support staff. We've got ADAMOnDemand.com.
That's the one we're referencing here, A.D.A.M on demand.
Yeah.
Is that for the man in the street? Is that for
100%?
Yes, it is.
Okay.
Right. And for the doctor's education, we've got the CMEinfo.com or the Oakstone.com. So you go to the Oakstone.
Okay, so you've got a variety, but if viewers go to A.D.A.M on demand
ADAM.com,
or ADAM.com, they'll find links to get through
segments. Yeah.
Right, now as we wrap up, I've got a couple of seconds left. Is there anything you'd like to add to the conversation? Anyone who'd like to finish with a closing remark? Dr. Nkomo, anything you'd like to close with?
Yeah, well, I say that look, empower everybody. You know about the famous thing about the Chinese and the fish and all that kind of thing. So that I think what you do have here is a possibility to be able to reach. You see, where you have got challenges of geography, time and space, now you need a medium which can be able to assist you to defeat that.
And as we go forward, that medium is arriving, and we can now reach that. Anything from your side, Rahul?
I think e-learning is still, in my opinion, is still emerging. And I think as you kind of talked about it, there's the classroom versus the e-learning, there's always a tussle, but there is a middle ground somewhere where both these mediums can coexist, complement each other.
All right. And from yourself, Gautam?
Sure. So I think that today health is leading towards an exchange kind of an environment wherein, you know, we want everyone and all the parties related in the whole thing to be associated with each other. So patients with the doctors, you know, doctors with the nurses, nurses with the patients. So all the parties involved, paramedics, outside, citizens, general. So we're looking at an atmosphere, you know, an environment, a surrounding wherein everyone has that free flow of information going on. And I think that should be the vision today, you know, the free access of the knowledge, information across all the, you know, bodies and individuals and parties which are associated in making this world a better place.
Okay, so I think let's wrap up with that. And I'd like to thank all of you for participating in this discussion. And I think it's really a call to action on the part of the viewers. Empower yourself, take ownership of your own health, use resources like this to educate yourself and to validate your interactions with the medical professional industry. Thank you very much for viewers for participating. I hope you've enjoyed the show. Thank you.
Thank you.